A stroke does not knock before it enters.
The mind's
It arrives
potential
suddenly,
is
silently,
limitless.
and often without warning. One moment, life feels normal. The next, everything changes. A stroke happens when the blood supply to a part of the brain is interrupted or reduced, depriving brain tissue of oxygen and nutrients. Within minutes, brain cells begin to die. Because the brain controls everything we do: movement, speech, memory, emotions. The symptoms of a stroke can be dramatic, frightening, and life-altering. Understanding these symptoms is critical. Recognizing them early can mean the difference between life and death, between full recovery and permanent disability. One of the most common and recognizable symptoms of a stroke is sudden weakness or numbness, especially on one side of the body. This often affects the face, arm, or leg. A person may suddenly find it difficult to lift one arm or feel that one side of their body is heavy, weak, or completely unresponsive. The numbness may feel like pins and needles or like the limb has fallen asleep, but unlike normal numbness, it does not go away. Facial drooping is another key warning sign. One side of the face may sag or feel numb. When the person tries to smile, the smile appears uneven or lopsided. The mouth may droop downward on one side, and the eyelid may not close properly. This happens because the stroke disrupts the brain's control over facial muscles. Another major symptom is sudden trouble speaking or understanding speech. A person having a stroke may slur their words, speak incoherently, or struggle to find the right words. They may sound confused or speak sentences that make no sense. In some cases, they may understand what others are saying, but cannot respond properly. In other cases, they may not understand simple instructions at all. Vision problems are also common during a stroke. These can include sudden blurred vision, double vision, or complete loss of vision in one or both eyes. Sometimes, a person may lose vision in just half of their visual field, making it difficult to see objects on one side. This loss is often painless and sudden, which makes it especially dangerous. A stroke can also cause sudden dizziness, loss of balance, or coordination problems. A person may feel unsteady, unable to walk straight, or as if the room is spinning. They may stumble, fall, or feel as though their body is no longer under their control. These symptoms are particularly common in strokes affecting the brainstem or cerebellum. Another serious symptom is a sudden, severe headache with no known cause. This headache is often described as the worst headache of one's life. It may come on instantly and be accompanied by nausea, vomiting, or loss of consciousness. This type of headache is especially associated with hemorrhagic strokes, where a blood vessel in the brain ruptures and bleeds. Confusion is another warning sign. A person may suddenly feel disoriented, forget where they are, or have difficulty recognizing familiar people or places. They may appear dazed or detached from reality. This confusion can happen quickly and worsen over minutes or hours. Some people experience difficulty swallowing, known as dysphagia. They may choke while eating or drinking, drool excessively, or feel as though food is stuck in their throat. This symptom increases the risk of aspiration, where food or liquid enters the lungs, leading to pneumonia. In more severe cases, a stroke can cause loss of consciousness or fainting. The person may collapse, become unresponsive, or fall into a coma. This usually indicates extensive brain damage and requires immediate emergency care. It is important to understand that not all strokes look the same. Some symptoms may be mild at first and worsen over time. Others may appear suddenly and dramatically. In some cases, symptoms may come and go. This is known as a transient ischemic attack, or TIA, often called a mini-stroke. Even though TIA symptoms may disappear within minutes or hours, they are a serious warning sign of a future, potentially fatal stroke. Doctors often use the FAST method to help people recognize stroke symptoms quickly. F. Face drooping. Ask the person to smile. Is one side drooping? Arm weakness. Ask them to raise both arms. Does one arm drift downward? S. Speech difficulty. Is speech slurred or strange? T. Time to call emergency services. Every second matters. Time is the most critical factor in stroke treatment. The longer the brain goes without oxygen, the more damage occurs. Quick recognition and immediate medical attention can save brain cells, preserve function, and save lives. Strokes do not only affect the elderly. While age increases risk, strokes can occur in young adults and even children. High blood pressure, diabetes, smoking, obesity, heart disease, and stress all increase the likelihood of a stroke. The symptoms of a stroke are the body's emergency signals. They are loud, clear cries for help from the brain. Ignoring them can have devastating consequences, not only for the person experiencing the stroke, but also for their family and loved ones. If you ever witness someone showing these signs or experience them yourself, do not wait. Do not assume it will pass. Do not try to sleep it off. Call emergency services immediately. Because when it comes to a stroke, time lost is brain lost.